Good to have you on the
mental
show.
health
I know
issues
you're
during
conducting
COVID.
clinical trials on these psychedelic drugs
What's happening
for
with people?
anxiety, opioid use. Tell us why LSD and magic mushrooms are more effective in treating these disorders than what's already on the market.
Well, I think that psychedelic medicines offer a new paradigm in mental health. We're really looking at what is the underlying cause of many of these illnesses that are affecting Americans. And traditional medicines in the CNS space that are treating things like depression, addiction, and anxiety really are seeking to numb and mask the issues that surround these illnesses. So things like Xanax, while they might make you feel better, they can also be highly addictive and are not dealing with the underlying problem or the underlying trauma that is ultimately causing you to have these mental health incidents. And I think it's important now more than ever as we continue here in lockdown with COVID-19.
You know, investors are calling this asset class the new cannabis, but like cannabis, it has to deal with the regulations. What kind of regulatory hurdles do you have to clear with these psychedelic drugs, and what kind of an impediment are they to growth in the industry?
Well, we're in many ways compared to cannabis, mainly because we're a Schedule I substance, but these are very different substances, cannabis and psychedelics. Actually, psychedelics were originally discovered and developed inside large pharmaceutical companies like Novartis in the early days of Novartis at a place called Sandoz Laboratories in Switzerland. In terms of regulatory hurdles that we face and need to achieve, everything that we do is federally compliant. We are doing everything through the FDA pathway or national regulators in various other countries where we conduct trials. We are not looking to go the same way that cannabis did on a state-by-state basis, looking for statewide approvals. Companies that are taking this biotech approach are really looking at proving out the safety and efficacy of these medicines at the FDA. There are efforts that are looking in some states to decriminalize and legalize psychedelics. Measure 109 just passed in Oregon, which would legalize psilocybin, the active ingredient in magic mushrooms. We think this is really a voice and the will of the people that we need innovative solutions to mental health, but we believe ultimately these become mainstream medicines only with FDA approvals.
You have some big name backers. Shark Tank star Kevin O'Leary, who's a friend here of Yahoo Finance, backs your company, also the founder of Tom's Shoes. How do you get those folks to buy in, and maybe that stigma around psychedelic drugs is beginning to dissipate?
Look, I was originally turned down by Mr. Wonderful when I first pitched him on the idea of using psychedelics to treat mental health.
What do you think? What's happening during COVID? A lot of people got mental problems. Mental problem cases are on rise. Maybe we need to open economy, and people have to take care of their health themselves. Put your opinion in comments. Thank you. Subscribe. Give a like. Thank you. Bye.